Good afternoon, and welcome to today's Side by Side with the Division of Mental Health, Developmental Disabilities, and Substance Use Services, Improving Our System Together monthly webinar. Before we get started, here are a few reminders about the webinar technology. Please make sure you're using a computer or a smartphone connected to the internet and the audio function is on and the volume is turned up. Please be sure your microphone is muted for the duration of the call unless you're speaking or asking questions. Questions can be submitted anytime during the presentation using the Q&A feature located on your control panel. We will answer as many questions as time allows after the presentation. American Sign Language interpreters and closed captioning options are available for today's event. The American Sign Language interpreters for today are Danette Stillman Bridges and Susan King Lanner. For closed captioning options, select the closed caption feature located on your dashboard. To adjust your video layout and screen view, select the View feature located in the top right-hand corner of your screen and choose the view that works best for you. Today's agenda topics includes introductions and MHSU IDD TBI system announcements and updates. We'll begin today with the 2024 year in review. Then we'll discuss the new strategic plan dashboard and talk about the new 2025 major initiatives in the strategic plan. There will also be time for questions after the presentation. At this time, I would like to turn it over to Kelly Crosby, Director of the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Thank you so much, Latoya. And I want to say a special thanks today to Susan and Danette for providing ESL services. And we chatted before, and I said I will try to talk slower to make sure that everyone can hear me and participate today. We do have a lot to cover, though. Latoya just went through the agenda. But really what we're trying to do today is to do a recap of 2024. We accomplished so much together, and there's so much to celebrate. While we talk about those accomplishments, I want to talk about how those things that we were working on in 2024, we're going to keep working on in 2025, right? Also want to talk about, we've talked about our strategic plan quite a bit, but today we are unveiling our new dashboard. So our dashboard are our data metrics where we'll track progress that we're making on for our system on metrics we think that matter. And we hope that these metrics are being affected by all the programs that were put into place. And then finally, we're going to talk about the strategic plan a little bit. But in this regard, I'm going to talk about each of the strategic areas and tee up for you a couple of initiatives we're going to prioritize here in the new year. Because as always, we want your feedback, we want your participation, we want your partnership. So we want you to know what we're thinking, what we're going to be focusing our time, attention, and money on. And we want to leave some space for you to digest all this and hopefully some time for questions. But know that we'll have many other venues to process today's information. For those of you that don't know me, my name is Kelly Crosby. I am a social worker, really proud of that. And I'm the director here of the Division of Mental Health, Developmental Disabilities, and Substance Use Services, and also traumatic brain injury and problem gambling. I've been in this field for over 30 years. I'm very proud to work here in North Carolina with our team and with the community. I'm also a member of the community. I'm a person with lived experience, and every day supporting family members and friends with mental health and substance use issues is part of my life. And we are hopefully building a stronger peer-led, person-led system of care here in North Carolina. Okay, next slide, please. I'm going to dive right into it with some announcements. The first few announcements are actually a recap of some things that happened at the end of the year. So the end of the year was busy, and I just want to make sure that we're able to highlight some big things that happened at the end of the year. So next slide, please. So first, I do want to say Happy New Year. I'm sorry, I didn't realize this slide was here, just as I was geared up to talk about the end of 2024. We're very excited for 2025. I was able to spend kind of the last 2 weeks of the year really reflecting and planning and preparing for this year with the team, my leadership team, with all the fine folks here on the call. And so we're very excited for this year, but want to wish everyone a happy, healthy new year. Next slide, please. So these should be the recap items from what happened at the end of last year. So one of the things you should have seen in Hot Topics that I'm super proud of is we updated some pages on our DMHDDSUS website. We're in the process of updating a lot more, but this is all about accessibility for us. So we spent a long time talking to web design teams, and then we spent a long time with consumers and providers in the field, thinking through what is most important if someone goes to our website. We also looked at currently now the places people are clicking on and where they're going. But at the end of the day, what we really wanted to create, first and foremost, was a website that was easy to understand and helping people that needed services know where to go. That was our primary focus, to be honest. The second focus was making sure that providers knew where to go, whether it was for funding or forms they needed or some rules they needed to know about. That was incredibly important for us. So we just wanted to make it pretty clear and user-friendly. We started with our homepage. It just talks about who we are and what we do. It tries to be in very simple language. There's 2 easy clicks right at the front to say, do you need help or are you in crisis? So we just tried to make it really clear. We share some data, we show where you can get data, but we just tried to make it somewhat simple, just explaining who we are. If you need a service right away, here's some things you can find, but here's some deeper dives on specific programs and services. We created a new assistance page. So again, if you go there, you can find basic, easy to access services in your area and also crisis services. We wanted to make that easier for folks. But then we have sections on intellectual and developmental disabilities, traumatic brain injury, mental health, substance use, veterans services, services for older adults, services for folks who identify as LGBTQIA+. We wanted people to have easy places to go if they wanted to find a very specific, oh, I want to know something about working if my child has an intellectual or developmental disability. So you can go right to that section. So check it out. Did a lot of user testing on these. And then finally, our crisis page. I'll save that because I'm going to talk about, when we talk about reflect on last year's crisis investments and work, one of the things we did work on was actually this crisis page. So a little more on that later. But again, we updated our websites. We announced that at the end of the year. We're always looking for feedback, and we will continue to be looking at who's using our pages and if they're being effective in the ways we want them to be effective. Next page, please. I want to remind folks that we are still very much here to support our loved ones, colleagues, friends in the West, in Western North Carolina. So we are still working on Helene recovery here in North Carolina. Towards the end of last year, we published our updated web pages with resources for the community, for first responders, for anyone in North Carolina. We also launched the Hope for NC program, which is putting over 100 crisis counselors in the field in the West. Those counselors began providing care and services in the community right before Thanksgiving, so the week of Thanksgiving, and additional cohorts of individuals are being trained and deployed in the West. A special shout out to our colleagues at VIA, Partners, and Trillium, who all are working with us and have staff deployed in affected regions. So we thank them for hiring staff, working with us on training, and getting those folks prominently engaged in communities. So anyone who needs supports can go to an easily identified person, ask for help, and they can provide some crisis counseling and get them referred and engaged in services if they need. So our websites are there, flyers are there, but know that we're still very much in supporting the Helene recovery. Next slide, please. Folks hopefully didn't miss that the retreat at Fernwood, which is a peer respite, opened in Raleigh in Wake County here in December. It was a wonderful event, incredibly inspiring. And you see Shireen Carrico from Promise Resource Network. You see Rob, the CEO at Alliance. This was a true partnership with PRN, with Alliance, with community members in Wake County, and we are honored to be asked to participate in this. So we're very excited about the respite. Stay tuned for more respites opening in other counties. But again, this is a peaceful retreat. It is an alternative for folks who might otherwise end up in an emergency room or calling 988 or 911. Nothing wrong with those options either, but this is a place to go that is peer staffed, where you can rest, feel rejuvenated, get supports from a peer. Really is a lovely and special place. So thank you to all the Wake County partners, and especially to Shireen and the Promise Resource Network team. Next slide. Hopefully folks saw that we announced the Innovations Waiver Waitlist dashboard. We also had a webinar to help folks walk through the dashboard. We did it during Eye to Eye, perhaps in hindsight, not the best time, so you might have missed it, but know that the dashboard will continue to be updated. We're very excited about this because we want to really share the data with you, right? Be very transparent, but also use the data to make good informed policy decisions. And you'll see a little bit later, also engage in activities with folks on the wait list. So on the wait list now, you'll be able to see statewide and also by LME MCO region, you'll be able to see demographics. So age, gender, and race of folks on the waiting list currently. This is the Innovations wait list. You'll be able to see the diagnoses that people who are on the waiting list have identified as their diagnoses. And you also get to see by county where folks are on the wait list. And so this tells us a lot already, right? It tells us a lot about those who are waiting. It tells us a lot about which counties have more people engaged or not. This is important, though, to marry this data with other data that we have, right? Like people who are actually on the Innovations wait list, the services they're getting, the services people on the wait list are getting. But again, just know this is the beginning of more things, right? This is important to be transparent and to use the data we have to make good policy decisions and to act. That's really important. So thank you again to our partners at the LME MCOs for working with us on all this data. Next slide, please. Also, we just announced a new 988 campaign. For those of you who follow, we often have new updated 988 campaigns because we are always, again, using data to see who's using 988, who maybe is not using 988, and we want everyone to know about it. So this is some new materials that was just developed for campuses. We have posters and all kinds of new swag like flyers, stickers, window clings. We try to do things that are appealing to younger people who might be on a college campus, but right now, materials are open, are free, and here's the link if you want materials for your campus, your dorm, whatever, they're all free. So this is our new 988 campaign. Next slide, please. January is Substance Use Disorder Treatment Month, and it's about supporting and celebrating individuals in treatment and recovery, providers who are providing treatment, and then family members. So the idea is very much to celebrate the recovery process, but also to offer supports to people, their families, and treatment providers. So stay tuned, there'll be more. You'll see more posts and more supports from us, but wanted to honor January as Substance Use Treatment Month. Next slide. All right, so let's do 2024 year in review. Now, what you're going to see hopefully doesn't surprise you. You should see the 4 main areas we spent a lot of time and energy on this year: crisis, workforce, justice, and child residential treatment services. So as a reminder, a lot of our focus was driven by the massive investment we got from the General Assembly for these areas in particular. So what we wanted to do today is to lift up a synopsis of what we have done this year on those initiatives, but also to say in 2025, here's what's coming on those initiatives. The first thing I want to highlight, though, before I talk about each individual one, if you go to the next slide, is actually your role in all of that, because really excited about that. So if you go to the next slide, this is both a celebration of how much time we've been able to spend with how many of you, but it's also, when you get these slides, these are all hot links. So if you missed an advisory committee meeting, if you missed a side-by-side, if you missed one of our general community webinars, you can go to any of those links to watch the recorded advisory meetings or webinar. to look at the materials from the meetings, like the slide deck, and in some cases to actually register for hot topics or side-by-side webinars. So I want you to know that working with you is incredibly important to us. On those main initiative areas that I mentioned that we're going to go through right now, each one had an advisory board. Want to remind folks of that. It was our responsibility, but also our privilege to meet with you every month to say, here's what we're thinking of doing with these dollars. Here's what our research has told us, and our research might be data, it might be talking to providers, consumers, LME MCOs. Here's what our research said. This is what we think we're going to do. What do you think? Right? That's really the point of the advisory group. So those advisory groups are still going. We'll use this year, of course, to look at our advisory groups. That's what we'll do to the top of the year. Which need a reset, which need a refresh. Do we need to add some based on new strategic priorities? So know that advisory committees will continue to be important to us, and you can still sign up for them. It's not like they're closed. They're not closed, so feel free to sign up. We'll continue to do side-by-side webinars every month. Have enjoyed these very much. It is our way to at the state level to really try to update you on the things that we're working on, the feedback we've heard from you, hopefully sharing things that matter to you. We have a variety of other community webinars. So for example, it's Substance Use Treatment Recovery Month, right? We often hold webinars in celebration of certain months, or like we've done the fetal alcohol syndrome disorder webinar. We did a webinar on supporting Indigenous people with mental health and substance use services. We do a variety of webinars to lift up certain things, often in partnership with you. So I think our most successful and wonderful community webinars have been whenever we've been able to lift something up in partnership with a community organization. So of course, you'll continue to see more of those this year. We've engaged with over 9,000 individual people through webinars, through advisory groups. And I actually have a goal of having that grow, right? I want folks to feel connected, to feel like they're understanding what's happening, but more than anything, to feel like that you're having a voice, having a say, and hoping to kind of change what we do, advise what we do. We really need that. We need a person-centered, a person-driven system here in North Carolina. That will make it the best system it can be. You're going to see a big emphasis this year, continued on accessibility. So we need to make sure that when folks reach out for services for themselves or a loved one, that we have the most accessible, open, friendly, accommodating system. So we want to engage with more and more of you. So thank you. Thank you to all of you that are on this webinar and all of you who've engaged with us over this process. We're grateful for it, and we just hope for more of it this coming year. All right, so let's talk about the initiatives. Okay, next slide, please. I think we will start with crisis. So let's talk about crisis. This is, again, year in review, as well as what are we going to do this year in the crisis space? A lot. You'll see crisis still in the strategic plan. So next slide, please. I can't lift it all up because there's a lot happening in this space. But remember, crisis, we're trying to make sure we have three things: someone to contact, someone to respond, and a safe place for help. 988 is important to us. Peer Warm Line is incredibly important to us. And we launched some things. As you remember, that's our peer mentoring line statewide, okay? We're always looking for ways to really capitalize on those moments when people call to help get them services. More on that in a minute. Someone to respond. You'll see a lot more this year, getting ahead of myself, in this particular bucket, right? Someone to respond works really well in some places and not that well in other places. We need to address that, okay? A safe place for help. One of our real celebrations this year is how many more places for help and spaces for help that we have created. Those are urgent cares, those are facility-based crisis. We call those community crisis because it's more digestible. It's peer respites. We're working on more IDD, so intellectual developmental specific beds and spaces for crisis in the state. So we continue to work on this continuum of care, and we'll be doing more. But I'll hold that thought. This slide has it, but I'll share it in other slides. So next slide, please. I remember I mentioned our websites. So one of the third website that we updated was our crisis website. We're working on something now called our Mental Health Crisis Services Campaign. We're calling it Crisis to Care, maybe. We're trying to make sure we use a term that really resonates with everyone. We do have a new crisis landing page. We sent this out through Hot Topics, and we've been trying to amplify it through our partners. It's very easy. The first thing it can tell you is how you get connected to 988. It says what it is, how you get connected. So you can connect right through the website, right? But it also contains some searchable maps. So if you want a safe place to go, you can search to find the nearest crisis facility, the community crisis facility, and that could be an urgent care, it could be a facility-based crisis, but it's the closest place to you, so you know where to go. And the third is there's a zip code search for which crisis team you can go to. But there's which like mobile crisis team is going to come to you if you call mobile crisis. Overall, we wanted that to be easy to find, maps where you could just search by your zip code. And then finally, we're really sandwiching the page to say, you can always just go straight to 988. Or if all else fails and you don't even want to look at these maps, just go right to 988. And we're working every day to make 988 stronger so they can connect you to a crisis team, so they can lead you to the nearest urgent care or community crisis center, or even link you to a clinician right then and there. Stay tuned for that. All right, we're also doing more to advertise this, right? So we've worked a lot with Google search ads, and we're working with a communications company to make sure not only that 988 is getting out there, you're going to see more PRN getting out there. The more that Some Things develops, you're going to see us marketing Some Things more. But really, when people Google search, we want them to go to this website. When they're looking for mental health crisis, we want this website to pop right up, and we want them to be able to find the services they need right away. And it's not just for people. This is also we want courts to see this, and law enforcement and DSS workers and providers. We want to make sure that we have an easy searchable tool for everyone. All right, next slide. So here's some accomplishments in the crisis space. Besides those, right? Kind of the continuum of care, having this crisis website. And the crisis website does nothing more than highlight all the work that was done. We've expanded community crisis beds. So almost 140 new beds in our community, both for children and adults. That's extraordinary. And 12 new urgent cares. That's huge. Look at the map. It's not everywhere. It's not every county. But realistically speaking, not every county actually can financially support or needs a crisis facility. It's unfortunate. We'd like one everywhere, but that's where things like mobile crisis come in, right? Okay. We also expanded more co-responder models. You'll see more of that this year. So we funded 4 more teams where a social worker or a mobile crisis worker is working closely with law enforcement in their response, like when someone calls 988. We added 8 new specific child teams. So that's Mobile Crisis Moors. It's a little different. It's a version of Mobile Crisis specifically for children and adolescents. Not only does it go to the home or go to the community and work with the family, it stays for them for several weeks afterwards to make sure they're okay, to teach skills, to try to do an analysis of what precipitated the crisis, and to link the family to the services they need to avert a crisis. So we're very excited about the expansion of Moors. And we have some information on the number of people, the sheer number of people who are reaching out on our crisis lines. Almost 122,000 people called 988. Almost 55,000 people called the Pure Warm line. And Some Things is just getting started. So we just launched Some Things, but we launched it in October. By November, we had 500 kids who had already reached out for the Some Things service. So those are real accomplishments. I always say, and I keep saying it, I think the first time I saw myself in a recording saying this, I was like, really? Is that what I meant to say? But I meant to say it. When someone raises their hand and says, I need help, it is a miracle. It is. It's so hard. It is so hard. For those of you who have contemplated reaching out or reached out, it is hard. It is our job to make it easier to reach out, more friendly to reach out. But then when people reach out, it is our responsibility to make sure that we have a warm and responsive system that meets their needs. But people are reaching out, y'all. Yay, people are reaching out. And we want more and more and more people to reach out. Next slide. So here's what we're doing in 2025. Right before the holidays, we announced our non-law enforcement transportation pilot. We're very excited. Remember, this is a pilot. We'll probably do a rural and urban. And this is to help transport individuals. Let me give you a classic scenario. Someone with mental health issues, maybe on involuntary commitment, is sitting in an emergency room. We found a bed for them in another hospital, not that emergency room, and they're being transported in the back of a police car by law enforcement. It's not the situation that anyone wants, okay? Nobody wants that. Hospital, person, Law enforcement. So we are piloting a non-law enforcement transportation approach. So a transportation company who can help individuals with mental health needs who are even under involuntary commitment get safely and humanely transported to their treatment facility. So we're excited about that. We're going to have more urgent cares and facility-based crisis opening this spring. We have put out funding and awarded already funding for 3 new peer respites in 2025. And we're doing a lot with technology, a lot. And people sometimes start phasing out when I talk about technology. So let me try to make this interesting for you. When people call 988, we want 988 to have the technology to ID and deploy the nearest mobile crisis provider, whether it's mobile crisis or those MORS teams for kids, and then track when they get there. It's pretty exciting. And then track the disposition of what happened. That's power. It's power to know what happened, to deploy, and to make sure we're with the team until they get to the person who asked for crisis. So that's very exciting. We also are looking at additional telehealth capabilities for 988, co-responder and mobile crisis models. So we're looking at if someone calls 988 and they are not in crisis, we've managed the crisis, but they're really for treatment right now, right? Remember what I said, it's a miracle when someone calls, it's not easy. Is there a way we could actually get them a therapy visit like right then and there? Telehealth visit? We're looking at that. We're looking at other states who have done that. Because again, when people are ready for treatment, let's try to get them treatment. And sometimes it's being just all in on telehealth capabilities. We also want to make sure that in things like our co-responder models, right? So a social worker goes out with a law enforcement team, or even just an EMT team or a team who went out from 911, right? A law enforcement EMT, that we're looking at other states who have equipped those teams with iPads that link to their mobile crisis team or to a mental health clinician that can help the individual in crisis. So we're just trying to be really smart with the technology because we think it can actually help a lot in crisis situations. So there's more in the crisis space, but I wanted to highlight those very practical reasons to invest in technology. Next slide. Let's talk about the Justice Year in review. Justice Year in 2024 and then what we're doing in 2025. Next slide, please. So remember, this is a lot. We call this the cake slide, just so you know, this is like our wedding cake or our celebration cake. It's busy and it's a lot. But I just want to say, here's where we are in the justice space, right? When you think about our role in the justice space, we want to make sure that individuals, law enforcement officers of the court, probation, parole officers, we want them to know about mental health and substance use treatment alternatives in their community. We want them to be well informed. We have a role in that to make it easy and help make sure they're well informed so they can make those kind of referrals for people that end up in court or arrested. We obviously have a big role in prevention and treatment, right? So when people do end up somehow attached to the legal system, can we make sure folks know about treatment options and we're providing good treatment so people can go to treatment rather than be incarcerated, right? So that preventative kind of treatment, but also for people who are in carceral settings, are they getting good treatment there? Whether it's MOUD, medications for for opioid use disorders, excuse me, or things like capacity restoration, where people can get mental health treatment that helps them be able to go to court and get out of prison. So treatment while folks are in carceral settings. So that's important to us. Community-based, while they're incarcerated and also when they come out, right? I was a clinician for many years in the community. I saw individuals who were involved in the justice system, juvenile and adults. That was a small part of what I did. I was not well equipped for that. I didn't know all the complications and I didn't know all the trauma issues and everything else that the persons I were working with maybe had in their lives. And so part of what we need to do is to make sure that we're equipping our providers in the field to make sure that they are well equipped to help people who have been involved in justice situations. Care management and resource navigation are the other two areas that we're very focused on. Care management, right? Because a lot of folks now, this is very exciting. I don't know if you're tracking the Medicaid 1115 waiver, but that is going to allow people 90 days pre-release, right? So these folks who are incarcerated 90 days prior to their release get Medicaid. How exciting is that? That means they can start to get care management while they're still incarcerated and then care management to help them navigate the system when they get out. So we already have actually a bunch of those care management programs, but now these folks will be able to have Medicaid. So how can we use our dollars to support Medicaid care management to better meet the needs of these individuals and maybe have justice peers on their team, peers with justice experience? Resource navigation is an important sweet spot for us, right? Because a lot of times folks struggle to engage in treatment, to maintain treatment because um, they don't have a safe and stable place to live, or they're unable to find a decent job that they want to work or need to work because of probation or parole. So we want to make sure that we're hyper focused on those real life supports, treatment, as I mentioned before, navigation of the system, and also very concrete supports of, in particular, transitional housing and employment supports. So this is kind of the universe. We call it the cake slide, like I said, where we know we have points of intersection in the system. So on the next slide, let's talk about how we funded that in 2024 and what we're going to do in 2025. So the next slide is we expanded reentry services. So those services are critical for people who are leaving carceral settings and coming back to the community. So we funded 5 new FACT teams. Those are forensic assertive community treatment teams. So in areas that actually have high rates of people re-entering the community, we are putting those FACT teams there. And those are really clinical teams. A psychiatrist, a clinician, a peer with forensic experience that are there to provide community-based mental health and substance use treatment and service coordination for folks reentering. So 5 new teams are coming. We also funded the UNC Fit Wellness Clinic, which is a wraparound integrated clinic. It's got mental health supports, peer supports, medical services and supports for individuals leaving carceral settings. So we expanded that this year. We also expanded our funding to LME MCOs. People may not know this, but you should know it, right? You know it, right? LMEs do everything. They're awesome. They provide, I don't know if you know it, complex care management and coordination for some of the most people with the most complex mental health and substance use issues coming out of carceral settings. So they do a lot to wrap those people around with both care management and things like transition and housing. I mentioned those, right? We'll continue to fund that, and we upped our funding for it this year. And that's a really good sort of tee up for when those folks are Medicaid eligible and they can get those kind of services, care management in particular, through Medicaid. All right. We also released a big application for diversion care management, right? So diverting people from the system, employment services for those involved in the justice system, and also transitional housing. So stay tuned. We'll actually be announcing those awards very soon. The next slide. So there's more on there. I'm trying to hit the highlights. So in this year, we'll be working with the state Medicaid agency on capacity building. That doesn't sound very exciting, but it is. Remember, people will be able to enroll in Medicaid 90 days pre-release. So those capacity dollars will go towards jails and prisons to get them ready to provide services, whether it's medications for opioid use disorders, therapy, care management, to prepare for that, to get people enrolled in Medicaid. So that's incredibly important capacity building we'll be building in those settings. As I mentioned, we'll be giving out more funding to divert people into services and care coordination before they end up in justice settings. I mentioned we'll be releasing funding for more housing and transitional supports like employment. This year, you're going to see a real focus too on juvenile justice. So we've done a lot in the adult space this year, but we'll do the same now. We're doing it now. We're looking at what is the good type of education we can give to family courts, DSS, juvenile probation or juvenile parole, excuse me. And then how about those care coordinators we have in those settings? How about the services we have for families and juveniles who are involved in justice settings? How about treatment when youth are in youth detention centers? And how about reentry support? Same thing, services and care coordination for youth. So stay tuned. That's complicated. We'll be working with DJJ, so Department of Juvenile Justice, working with our LMEMCs, of course, with our departments of social services, with our Medicaid agency. That's complex, a lot of moving parts, but we're all aligned on that same goal. How do we get kids and their families and coordinated services and treatment? And lastly, we've talked many times about capacity restoration. So that is people who are with mental health issues serious, who cannot go to court until they get the appropriate treatment for their mental health condition, and also training on what the court process is like. We announced right before the holidays. You probably saw Secretary Kinsley. You probably saw some press releases. There was a pilot in Mecklenburg County at the end of 2023. It's a lot of there was a lot of excitement. The program was full, and at the end of the year, we announced 2 new programs in Pitt and Wake County. So that's really exciting, really exciting. So folks can get the treatment they need, go to court, and then come home sooner. Okay, next slide. Workforce year in review. I'm actually looking at the clock. Lot to cover. So there's a lot to cover in workforce. So I'm going to try to sum it up. Next slide. We're trying to do 3 things. We're trying to work on easy, high quality education for our workforce. Not education for education's sake, but when you think about what education is for, it's to make sure that our qualified professionals, our direct support professionals, our licensed professionals are well equipped to meet the needs of people in our public system. That's our duty. We want to make sure that people that we're training are actually getting employed. So that's not always the case. Like with our peer support specialists, they may get trained, but there's a lot of barriers. Maybe folks have been employing them or hiring them. And so we're trying to make sure that we are working on actually getting our certified folks employed, or even like licensed professionals to come into the public system. And then we're looking for ways to elevate the workforce, right? So sometimes if you go through a state training, well, that's nice, and hopefully it made you better at your job. But if you did, is there a way for you to move up rank-wise to become a supervisor, and also to get a differential rate for the work that you put into that? So this is kind of what we're doing. Make sure we're good on education, getting folks employed, especially places where we have shortages. And then we are making all that work we've done to get folks into this pipeline meaningful. Next slide. You see we've focused a lot on peers. So on this slide, you're going to see everything from the peer scholarships we've done this year, the standardization we've done around the certified peer curriculum. We've launched a peer job board to help people get jobs. It's already paying off. But we'll also be doing more in the new year on employer supports to hire peers and supervise peers. We've done things like the Chess app, which is an app for people who are maintaining their substance use recovery. It's peer run though, so there's actually a peer support function on the Chess app that's getting a lot of uptake, and people are really enjoying it. In this coming year, we're really going to work on designations, especially for folks who are supporting individuals in crisis, individuals in the justice system, and folks with intellectual and developmental disabilities. So we're working with the peer community on these specialized trainings for folks. So we have all kinds of peers. We're tapping into the special skills of everyone. And I mentioned we'll be doing a lot more on that job matching. So certified peers are getting jobs where they feel really valued and well used. Next slide. Direct support professionals. We've done a lot in this space as well. We continue to work with the North Carolina Community College system to work on a pipeline. So they're recruiting from high school. They have trainings for direct support professionals, and they have paid apprenticeships with providers across North Carolina. So we're trying to work on that whole continuum. We have RFPs out. We sent them out in the new year. So I think they're both closed. These are for recruitment and retention grants for direct support professionals. We're also working on with things that help elevate the field, like the use of technology. So we can rely less on DSPs and more on technology in places where it's actually appropriate. There's something really important on this slide at the very bottom. We're working with our partners at the LME-MCOs, just again, that notion of if we have direct support professionals who got their associate's degree, who worked on these advanced programs, who have X years of experience, can we actually offer them a career path for growth and a differential wage? So we've heard that a lot, that helps with retention in the field. So a lot happening in the DSP space. It will continue to happen. We have a direct support professional workforce plan. And the ultimate goal, remember, the ultimate goal of the DSP plan, all these initiatives are doing, is to help people be recruited into the field, want to be in the field, be well trained, to stay with an individual or a family for some time, reduce turnover, and make sure that people are getting services so they're not going without because there's no workforce. Next slide. Next year, we'll be really focused on both professionals and qualified professionals. So we're actually doing with UNC SHEPS a comprehensive workforce study in the mental health and substance use field. We will also be doing a loan repayment program for licensed individuals. It'll be a big one, y'all, like a big one, like millions and millions of dollars to get people to come into the field and stay in the field. We're also working on the qualified professional designation with community colleges to make sure that there is a well-advertised associate's degree that people can get to prepare them for working in the mental health and substance use field here in North Carolina. And that our rule allows for these folks with associate's degrees to practice in our service delivery system. So again, building the pipeline. Next slide. Have to give a nod to the Medicaid rate increases that we were able to do January last year, right? So a whole year ago, massive increases to Medicaid rates that are sustainable and ongoing. We are looking at what that has done for utilization or folks entering the field. But again, want to lift that up again. That was a huge investment in workforce this year. All right, the last area I'm going to talk about with 2024 recap and 2025 going forward on the next slide are residential child behavioral health. So that's a mouthful, but we're really talking about level 2, 3, and 4 group homes and psychiatric residential treatment facilities. Let's talk about what we've done so far. So last month, our side-by-side was all about this topic, right? Kelly Shishko came on, I talked. Next slide, please. So we've done just something small at first, but let me just remind you what we're doing. Our goal is to help children stay in their homes. I never want to forget that that's the eye on the prize, right? The goal is if a child needs mental health services, if their families need mental health and substance use services, they can get them in the community. And we're able to help kids stay at home and get the services and supports they and their family needs, period. So that's a home, it's a school. We need enough community-based organizations, right? We also need good crisis services if a child is destabilized. So that could be anything from mobile crisis MORS to enough child facility-based crisis beds or urgent cares across the state, respite centers if a child is in DSS custody. For children who are in out-of-home residential settings, we need to make sure, again, we have a strong set of community-based services and family-based settings for children to come home to, right? When we need to get kids home, we need them in wraparound services. And in rare cases, when children do need out-of-home treatment placement, we need it to be a good system that gets the child there with a thorough assessment, a highly therapeutic and clinical environment where the child is getting the type of intensive services they need, as well as the family, and that we're able to return the child back to their home and community as soon as possible. So this is a important but very small. We want this to be the right size in the system, not too big, really small. Because again, the goal is to serve children in community, not in out-of-home residential placements. That's not the goal. The residential facilities aren't the goal. The goal is children in home and family-like settings in the community with community-based services. Okay, next slide, please. We have done, we are working on this continuum. We've showed you this slide before, but so I won't go through it again. But I want to tell you what we've done and where we're going, because this is one I'm very excited about. You're going to hear us talk a lot about this in 2025 about where we're going. So next slide, please. Last month, we talked about investing some money in what we call environment of care programs. These will impact 414 youth right now. And this is a very small amount of the investment. I'll tell you about the rest of the investment in one slide. But these are, again, acknowledging the fact that we've got hundreds of children in out-of-home residential treatment facility settings now. And we want to make sure that those children get the benefit of some of this funding. So they're getting better therapeutic space, sensory rooms, more recreational equipment, even things like sheets and home repairs and new paint in their rooms. Because the children are there right now, and we want to make sure that a highly therapeutic, warm, home-like setting is what the children can experience right now. This is not treatment. I'm not saying this is therapy. And this isn't me saying, boy, we hope children stay there forever. That's not me saying that at all. It's me saying we want to show them that they matter. They are there now. We know they're there. And we want to make sure that they have a very home-like, nice setting with the right sensory and recreational spaces right now. But that was just the tip of the iceberg. The next slide is going to tell you what we're really going to kick off in 2025. We are working on quality of care for all psychiatric residential treatment facilities. All facilities that got funding on that last slide, the funding is contingent on their participation in this program. There will be state-sponsored training for all staff, and that will be on de-escalation and therapeutic techniques. We will pay for that. We will pay for the equipment, but we will ensure that it is well implemented. We want staff well-trained, well-equipped. And studies and other states have shown that this leads to massive decrease in escalations and incidents in residential facilities. They will also be participating in measurement, monitoring, and quality improvement activities across these facilities. Okay, that's important. Quality is important to us, right? Next, all children currently in PRTF level of care are going to have assessments to determine their needs and to talk about discharge plans into community services. We're going to continue to work with our sister divisions on this trauma-informed assessment and a process for admitting kids to residential care. It's a big deal when children are admitted to residential care. We want to make sure they have the most thorough assessment, and it really, again, the goal is for community placement with wraparound supports. So we want to make sure that that pathway to an out-of-state residential treatment facility is very tight. We will also continue to work with our sister divisions on those community-based services. Again, we need it to be easy for DSS. We need it to be easy for families to access and understand. And it's not okay to say, oh, you don't have that service in your area. So here are 6 counties over, you don't have it in your area. All families deserve good, high-quality wraparound services in their area. So we'll continue to work with our LME MCOs and our sister divisions to make sure we have enough community-based services for children. We're also going to pilot things like alternatives to residential treatment or brief residential care. And I mean intensive wraparound supports. We have some children right now with very complex needs. And those are often the children that end up in out-of-home residential treatment placements. And those might be children who have both mental health needs and autism or intellectual and developmental disabilities. They might be older children who've had multiple placements out of the home, who've had a significant amount of trauma, may just have very complex needs. These are the kids that we need to explore more intensive community-based models for. And in some cases, where we know we already have children in residential facilities, maybe some brief, intensive, specialized residential care. Again, hear me say the focus is on community-based wraparound services for children. But for children who are in residential facility, we need to make sure it's highly therapeutic, home-like, and specialized treatment is available for kids who need it. We also are going to continue to improve crisis care and avoid unnecessary emergency department visits. So I mentioned how this ties in with crisis. So we need more mobile crisis MORS teams that are well advertised, that families know about, that schools know about, and that there are community-based services, and there are also urgent cares and community crisis beds for kids. And lastly, this is probably the most unsexy one, but quite important. We will be looking at Medicaid clinical coverage policy and also rules for residential facilities to make sure that those settings are highly therapeutic and have high levels of both mental health treatment and psychiatric care at those facilities, amongst other changes. There's a lot, but this one's really important. And it was worth doing a little bit of a deeper dive, even though we did it last week on Side by Side. I hope you hear what I'm saying. These children are incredibly important to us. They have complex needs. We need to make sure that their needs are met in the community. We do have many children in out-of-home settings right now. We need to make sure those settings are highly therapeutic and home-like for them. We need to assess those children and determine a good community-based discharge plans for those children. All right, next slide, please. Okay, so I'm gonna have to be quick, but 2024 was a busy year. You did a lot in 2024. And the theme I want you to hear is take these slides, digest them, hear that we did a lot. We're gonna keep on those courses. We're not gonna abandon those things we started. We're gonna keep going on them. They are incorporated in our strategic plan. And drumroll please, our strategic plan dashboard is now live. I'm gonna go, we have 7 strategic areas on the dashboard. I'm gonna go through one measure on each of these, just one measure, because then I'm gonna tee up one more thing before we finish. So let's look at the strategic plan dashboard. Next slide, please. So that's what it looks like. We blew past it. Can you go back one slide, please? There's a link on our website. If you go to the homepage, it'll take you to the strategic plan and the dashboard. Every priority area has multiple measures. I believe each priority has 4 measures, so there's a lot. So I'm going to show you one from each priority areas. Priority 1 is increasing access to care across the state. This particular measure, look at this measure, it goes back to 2018. These are the number of people who went for one visit for treatment and then went to another one. Do you see how static we are? We're very static. So we actually want people, and this is good, we've been measuring for a really long time, but we want people who go to a visit, think, oh, it was a pretty good visit. I'm going to give this a try. We want that to go up, okay? All right, so that's one measure, 1 of 4. Let's look at one more measure in the next one, which is improving access to quality IDD and TBI services. This one is near and dear to my heart. This actually is the number of people on the innovations waiver waitlist who are receiving a service. We're actually growing in this area, y'all. We're growing in this area. It has been one of the measures that we've been working with our wonderful LME MCO partners on for some time. But the number of people on the waitlist who are getting services continues to grow, and this will be a priority focus for us this year as well. Okay, there are more measures. Next priority area, though, we're going to talk about preventing substance misuse and overdose. So this measure is looking at the number of people who go to an opioid treatment program, OTP. This is a place where they can get medications for opioid use disorders, like methadone, just to use a simple one. Again, we are one of the states with the highest number of OTPs, really proud of that. And every year we see continued growth among the number of people who access the service. So we're very proud of that. We'll continue to work on that though. So they're advertised and we have mobile clinics. So more and more people are accessing medications for opioid use disorders. More on that. The next slide is building the workforce. Again, there's more measures in all of these. We're just doing one on building the workforce. This is exciting. This is the number of certified peer support specialists who are actually employed in our field. Look how it's growing, y'all. It's growing. That's what we want. Certified peer support specialists are amazing, right? Do amazing things. They can really help people in their recovery journeys. If they're certified, we would love to have them in our workforce, helping others. And that's continuing to grow, which is exciting. Next slide is a crisis measure. So on the next slide, this is our number of folks with calling, chatting, or texting 988. That continues to grow month over month. We're at about a little over 8,000 calls, chats, and texts a month. We have this broken down in many ways. You can stratify this. But amongst young people, our chats and texts are rising, which is really exciting. So we'll keep watching this. Next slide, please. We have an array of measures about serving individuals in the justice system. This one actually looks at capacity restoration. So remember, we started it late or early last January, right? Yeah, the programs continue to fill up. And we think this will continue to grow as we we expand capacity in Mecklenburg and open up programs in Pitt and Wake County. Next slide. Amplifying recovery and community-based services. So one of the things we want to make sure is that we have peer respites and peer living rooms, peer run centers just across the state. So this one, we have seen some growth at the number of people receiving supports from a peer run center, and we want this to continue to grow. So that was just a snippet of a measure on each, on the dashboard. So please look it up. There are 28 to 30 measures, I think. There's a lot. But remember, what we are trying to say is all the programs that we're working on, we expect them to make a difference. There's more access. We're preventing more harmful things like overdoses. We're getting more folks into the workforce. We're having a stronger crisis system that people are actually using. So we're trying to measure that our programs are actually making a difference. And measures will change over time. Okay, next slide. So I've got just a few quick minutes to talk about new initiatives in the 2025 strategic plan. We did the strategic plan walkthrough. I walked through it at I2I as well. I'm not going to bore you with the whole big walkthrough of it again, not at all. But I do have a goal. I just walked through last year's priority initiatives. And I told you what we did, and I told you what we're doing. We're not abandoning those. What I'm telling you today is not all of our initiatives, but a couple of really important ones that I want to throw out to you to tell you we're really working on this now So you won't be surprised when we start talking about it or asking you to support it, okay? Next slide, please. Priority 1, increase access to care across the state. If you've learned anything about me, this is my most important favorite thing. I want no stigma. I want everyone to know where to go. I want it to be clear, easy, welcoming, and warm. Okay, next slide. So a couple of things we're focused on. We're gonna keep doing all the things we've been doing, but we are focusing on something called our care directory online and our open access appointments. So remember how we have on there, here's where you can go for crisis. We want to make sure that we have an easy care directory online so folks can find walk-in clinics or places for a first appointment. They don't need to find all the services. They need to find a detox. They need to find where they can walk in and get an appointment. That's all. It needs to be clear and understandable. And we want to make sure that people know where they can get a same day or next day appointment. And that can include virtual appointments through 988. So that kind of access, when someone raises their hand, let's capitalize on it. Let's make sure they know where to go right away. The other big initiative I want to talk about this space are certified community behavioral health clinics. We've had about 8 to 10 of these in the state for many years now. You can hear all of a sudden you're going to be like, wow, that's all Kelly talks about. Certified community behavioral health clinics are really important. They are that one-stop shop in the community. Remember, everybody wants the community mental health clinic to come back. That's what these are. They're a place that have a variety of services. They either provide also primary care, so physical health care, or coordinate. They provide crisis services. They provide outpatients and other services. And we are going to be supporting not a bazillion of these, but enough of these strategic like mental health centers across the state so people know where to go for comprehensive care and same-day care. Okay. Next slide. Increasing access to IDD and TBI services. Next slide, I'll show you a couple stars, what we're super focused on. We're going to be super focused this year on Inclusion Works. Remember, helping individuals who are not in competitive integrated employment but want to be, to get into competitive integrated employment, and working with those awesome employers, folks who do IDD supported employment right now, to coach others and have new models of doing business in their communities if they so choose. Another big focus for us is going to be that wait list, y'all. There will be active outreach to members on the wait list and getting those folks into services. We're measuring that for a reason. 45% of people are getting services. We want it to be more and more and more. We have the I option now. I understand it's not perfect, but the ability for people to get services is huge. The ability is huge. So let's reach out to folks and get them connected to services. That will be a big goal of ours this year. Next slide. Preventing substance misuse and overdose. Next slide. We're going to focus big on substance use disorder treatment for adolescents. You know we don't have a lot of it. You probably knew that. You might not know that. Well, we need it. We need more of it. So the team has been working with providers and LME MCO colleagues on more access for substance use disorder treatment for adolescents. We're also redoing our prevention plan for the state. Prevention's exciting, y'all. We want you to see a big old prevention plan for us and a vision for prevention. So you're going to see that this year. And like mentioned, we are deploying many mobile OTP programs, so trucks, into rural communities where people can't get to treatment. We'll be deploying those into the community this year. Super excited about that. All right. Next slide. I know I'm super low on time. Workforce, next slide. I already said this. There'll be a big focus this year on both licensed professionals and qualified professionals. We're not going to stop working on peers and direct support professionals, but we are going to focus on these two groups now. Next slide. Crisis system, next slide. Financial sustainability is going to be a big deal for us. We're working with LME MCOs, counties, and Medicaid on sustainability of all the crisis structures we've set up. And this year will be highly focused on someone to respond. Remember, we did a lot on someone to contact with 988 and some things. Safe place to go. We built 12 new BHECs and 120 new community crisis beds. We need responders, whether they're MORS, mobile crisis, whether they're co-responder models. We need to crack that nut, make it sustainable, and make sure it's meeting the needs of community. So that's going to, that someone to respond is going to be our focus this year. Next slide. Justice system services, next slide. We're really going to be focused on diversion this year. So diverting people from the justice system in the first place, juvenile justice, I mentioned, and then we're going to make our awards for transitional housing and employment. Really excited about building that capacity across the state. And lastly, I already mentioned with our recovery and community-based services, these are our individuals with the most complex of needs. Next slide, I've already mentioned how we're going to be working with children who are in residential treatment facilities. The two other things we'll be doing. We'll be expanding, promoting, and advertising our first episode psychosis programs, but also modernizing and supporting our clubhouses. We believe in Clubhouse. We believe it's an important model for people with severe mental illness. So we'll be lifting that up and supporting that this year. All right. So I've done an awful thing of leaving no time, but here's what my team is going to do. My team always gives us probably within an hour feedback, comments, and questions. And we'll do our best to answer those, whether it's in another training, whether it's in a hot topic, wherever it is that we need to answer your question. So we value you being here. Thank you for listening to me cover so much, but we really were trying to stop. Here's all the awesome stuff we did last year. Here's our plan for keeping it going. And here's the new things. But remember where we started with all of this. We'll want your advice. We'll want your support. We'll want your criticism. We actually do. We'll want your guidance on where we need to change direction or do things differently or better, because this is our system and our community, and we cannot do without you. So I'm grateful for 2024. I'm very excited for 2025. So I will see you next month if I don't see you at an advisory or other committee meeting in the meantime. So take care, everyone. Thank you so much.